welcome back to my channel. In this session, I'm planning to discuss something about the flexor retinaculum. Flexor retinaculum, we know it's a very important topic, be it for theory or for practical. So you need to know the attachments of the flexor retinaculum, the main components of the flexor retinaculum, that is the structures passing above it, below it, what do you mean by carpal tunnel, all these things you should be knowing thoroughly so that you can answer all the questions asked from the flexor retinaculum. So let's see, I'll be discussing it with the help of a small diagram. So please do let me know whether it's useful for you. Now let's discuss about the flexor retinaculum. This green colored thing is the flexor retinaculum. So we know that the flexor retinaculum extends between the carpal bones. So this can be considered as the medial side and this can be considered as the lateral side. So we know which are the carpal bones which you get on the medial side. We have the pisiform and in the next layer we have the hamate bone. So these are the two bones which you get on the medial side. We know the rule, that is scaphoid, lunate, trigutral, pisiform in the proximal row. And the second row we have trapezium, trapezoid, capitate, hamate. Okay, so that is the hamate in the distal row. So pisiform and hamate which comes medially, and laterally we have the scaphoid in the proximal row and you have the trapezium in the distal row. See, these are the two attachments. The flexor retinaculum spans between the scaphoid and trapezium on the lateral aspect and pisiform and hook of hamate on the medial aspect. So this major green color is the flexor retinaculum spanning between these two sets of bones. Now we can see that there is a superficial slip coming from the flexor retinaculum and getting attached to the hamate and pisiform. That is known as the superficial slip of flexor retinaculum. Likewise, we have an additional slip going laterally deeper, which is again getting attached to the trapezium, and that is known as the deep slip. So we have the superficial slip and as well as the deep slip. Now let's see what are the contents passing through the superficial slip and deep slip. Superficial slip, since it is medial most, it's very easy. We have the ulnar nerve and vessels. So this is the ulnar nerve and this is the ulnar vessels. Okay, so these are the ulnar nerves and vessels which you get under the superficial slip. When we discuss under the deep slip, we have one single tendon, that is Flexor Carpi Radialis. We know this is the lateral aspect. So it is the Flexor Carpi Radialis which is seen passing through a small compartment formed by the deep slip of flexor retinaculum. Now we have to think about the carpal tunnel syndrome or how the carpal tunnel is formed. We have the carpal tunnel, the carpal bones here and the flexor retinaculum here. So the cavity enclosed like this between the carpal bones on one side and the flexor retinaculum on the other side, excluding this flexor carpi radialis. This is known as carpal tunnel. Now, which are the tendons which you get in the carpal tunnel? The superficial layer, we call it as Flexor Digidorum Superficialis, which are actually the tendons passing to the digits superficially. And deeper to that, we have the Flexor Digitorum Profundus. So these are the two layers which you get on one side, and there are four tendons each for the Flexor Digitorum Superficialis and Flexor Digitorum Profundus, moving on to the digits. Now, another tendon, one more tendon which you get, which is going to the thumb, is known as Flexor Pollicis Longus. So all the digits, including the thumb, are getting two sets of flexors. One is Flexor Digitorum Superficialis and Profundus and the other one is Flexor Pollicis Longus exclusively for the thumb. So all these tendons are passing through the carpal tunnel which is bounded by the carpal bones as well as the flexor retinaculum. And this flexor carpi radialis is actually considered as if passing through a separate tunnel formed by the deep slip of flexor retinaculum. And we have the median nerve as the major content of this carpal tunnel, and we know whenever there is an increased pressure inside the carpal tunnel, be it from the arthritis inflammation or from the tenosynovitis, all this inflammation will lead to increase in pressure in the carpal tunnel and will ultimately compress the median nerve. And that is how you get the carpal tunnel syndrome, where the patient will be presenting with numbness, paresthesia and loss of power along the distribution of the median nerve. Now let's see what are the structures apart from all these lying superficial to the flexor retinaculum. So we can see that there is one tendon in the middle that is known as palmaris longus. Then you have two cutaneous branches. This is the first cutaneous branch, this is the second cutaneous branch. Since this is lying medially, we can call it as palmar-cutaneous branch of ulnar nerve, and since this is lying laterally, we can call it as palmar-cutaneous branch of median nerve, because we know on the palmar aspect we have mainly two nerves supplying. One is ulnar nerve and the other one is median nerve. So palmar-cutaneous branch of ulnar nerve medially and palmar-cutaneous branch of median nerve lying laterally, and there is one small artery lying, again the cutaneous branch of radial artery. So radial artery gives off a cutaneous branch, palmar-cutaneous branch, that is the palmar-cutaneous branch of radial artery. So these are the main structures which comes in flexor retinaculum, and the importance of carpal tunnel, we know there is one major structure lying within the carpal tunnel, that is the median nerve, which is usually compressed whenever there is an increase in pressure in the carpal tunnel. Now ulnar nerve and vessels again are lying in a separate compartment formed by the superficial slip. So when we say the structures passing above the flexor retinaculum, we can include all this, starting from the ulnar nerve, vessels, then you have the cutaneous branch, palmar-cutaneous branch of ulnar nerve, palmaris longus tendon, palmar-cutaneous branch of median nerve, and the cutaneous branch, arterial branch that from the radial artery. And when we talk about the structures lying below the flexor retinaculum, again all the components of the carpal tunnel and flexor carpi radialis we can mention, but when we are asked about the contents of the carpal tunnel alone, you have to mention only the flexor digitorum, superficialis, profundus, flexor pollicis longus and median nerve. And we can see that all these long tendons are enclosed in a synovial sheath. So the synovial sheath enclosing the flexor digitorum, superficialis and profundus, you call it as ulnar bursa, which is moving on or continues with the synovial sheath of the little finger. And this one, the covering the flexor pollicis longus, we call it as radial bursa. Which is in continuation with the synovial sheath of the thumb. So that they are the continuations of the ulnar bursa and radial bursa. So hope you have understood the topic. Thank you. Thanks for watching. Please do let me know whether it's useful for you.